As commissioners, so CALD is one of the affiliates of your organization, KAC, Kansas Association of Counties. So we're part of county government as well, just as the health department is part of county government. And in fact, CALD is one person. There is nobody else in the organization. We're small, so we're akin to that. And my cubicle space, if you will, is in the Kansas Association of Counties office in Topeka, right across from Topeka High, and a couple blocks down from the Capitol, which is convenient for Bruce Gladney and Jay and I and all of us that work with the Kansas legislature to be just have that close proximity. So today I thought we'd just talk a little bit about a foundation and why public health should be a priority, is a priority in many parts of our country and in local communities. Roles and responsibilities that you have as the Board of Supervisors or as the County Commission, as it says in statute. My caveat to that is I am not an attorney and I am not your attorney. So I'm approaching this from an executive level perspective of what the statutes say, not as legal advice that you could, of course, and should, of course, give to your county counselor, whoever that might be. I guess is Mr. Mosier's name over there. And then operationalizing public health. And again, this will be kind of at a system level. I'll show a little bit of system level data with you, but of course, it is specific to your community. And a phrase in this work that is pretty common and I think is pretty fair. If you've been to a health department, you've been to one health department. There are the same number of health departments in the United States as there are in counties almost. In Kansas, there are 100 health departments serving 105 counties, so we're pretty close. I mean, all of them are truly unique and customized, if you will, to the resources and the needs of their individual communities. But we'll look at some of that as well. So why should public health be a priority? I would like to help you think about that a little bit as Board of Supervisors for your community. And this is a definition. There are many out there if you go looking for them, but it's one that I've found is at least simple for those of us not in public health to think about, I hope. It comes from the Institute of Medicine. It's simply what society does collectively to assure the conditions for people to be healthy. That's very broad. Public health, as you probably experience as you look at resources and work with Lisa and try to decide what's the priorities out here, is, if you will, if we think of an alphabet, it's everything from A to Z. And pragmatically, most health departments can't do all of A to Z. So it's like anything else. It's like our own budgets and our own families or our own business, whatever our profession might be. We have to set priorities and see where data takes us, that we really should be focusing our resources. So doing all for everything is what we aspire to. Can we do that? That's not probably realistic for you like it is most others as well. So this little graphic I found is kind of handy, and it talks about what goes into your health. And the little person there, so socioeconomic factors. So education, our jobs, our family, our support, our income, community safety, all factor into the health of an individual and or globally public health. Physical environment. So where we live, where we come to work, in places like this, what's in our community is another factor in that. Our health behaviors, which if we go get a visit with our physicians once in a while, which hopefully we all do, that's good public health as well, so preventative care for our physicians, all factors in as well. So how we eat, our activities that we participate in, what we consume, if we partake in some things that are more harmful, like tobacco use, alcohol, all that stuff factors into our health. Good food, the sweet, the fat, the salty food, that all factors into our health as well. And then health care. Do we have access to health care? What kind of health care do we have access to? Also factors into it. All of that, the little graphic just shows there, it's really only about 20% of what happens in healthcare that impacts our overall health as individuals. Corresponding with that, that is where in the United States of America we spend most of our money, is on that 20%. Particularly think about yourself, if you're needing medical care, persons in your family or friends and associates, we get a little older, we consume a lot of health care typically. particularly when we get pretty serious illness, we consume a lot of health care. If we can work on that 40, that 10, and that 30% upfront over our lifetimes, both individually and as systems, hopefully we can reduce that 20% cost later in life for healthcare. So a little background, this is national data here from a group that collects this information. This is 2023, 2024s aren't out there at this time. It takes quite a bit of time for them to analyze the data, but America's health rankings in health, just like rankings in about everything we can find in our modern society. And what's a little hard to read, so on the right-hand column, clear at the bottom, number 29 is Kansas. So, 29 out of 50 isn't the worst in the world, but it certainly isn't the best. Showing that there is more we could and should be doing in Kansas to improve our health care and our health outcomes for everyone. What another colleague in our system talks about with folks, and he's with Kansas Health Foundation down in Wichita. They've set the goal as a foundation to make their investments, and their foundation is from a private hospital that closed in Wichita area, I think about 30 years ago. And their tax law, that private not-for-profit company, those funds had to be dispersed somehow, and the way that gets dispersed is they created a foundation to then fund future work. They've established the goal for Kansas to become number one in this data set here. 29th to 1 is going to take a little time, a little effort, a lot of contributions from a lot of folks. But part of his rationale when he speaks is in the mid-1990s, Kansas was 8th in the same data set. Why has Kansas slipped so much from 8th to 29th over about a 30, 35-year period is an important question. And there aren't good answers to what that might be. But the data is informative to know we have slipped significantly. We should be putting our effort and our conversations towards how can we begin to improve in that. Ideally, to get to 1. Similar, another source, this is county data by the County Health Rankings Group. Green is good, dark green is the best. See a couple of kind of yellows there in, let's see, that'd be Edwards County and Kingman County. But you guys over here in Greeley are pretty good, like a lot of the states. Your health's better than many others around the country. But still a margin for improvement in being out of that third darkest shade or third lightest shade of green there. So improvement can be made. So county level, state level, national level, we can see the need to improve. With that, and chronic disease is one important element. It's getting a lot more conversation in our society in the last few months. We'll see how that may grow and improve over time. But chronic diseases count for most disability and death in the United States. And with that comes a lot of cost. And that's from the Centers for Disease Control, current data on their website as of April 9th when I pulled this together. So even though there might be changes in philosophy about public health that are coming from the new Health and Human Service Agency and the new administrator there, Mr. Robert F. Kennedy Jr., he is keenly focused on and recognizing that this is costing our society tons and tons of money. These are a few data sets off of that same report, off of their website, that I just thought might be useful and illustrative, hopefully in some way. Top left there, heart disease and stroke. More than 944,000 Americans die from that every year. And that's 1 in 3 deaths in the United States. So with that, good researchers, not my expertise to do the research, but they compute the cost of that. The healthcare system is about $254 billion and a loss of $168 billion in productivity on the job every year. I won't read you all the other ones. You've got the materials there, but just other diseases, cancer, diabetes, obesity, the ones that cause the most problems, come at the most cost. Tooth decay in children, we don't often think about that. Kids are young and healthy almost all the time. There's a few children who are blessed in that way. they're pretty resilient little creatures that we have. It's as we get older and we get less healthy, but those teeth are really important to those being healthy as part of the factor that's in there. And then making sure they're healthy and in school. It's hard to concentrate for us adults. It's hard for children to concentrate too. If they have unmet medical needs and they can't focus in the classroom, and somebody has actually helped compute that cost of 34 million school hours being lost because kids are going out to appointments that could be avoided if we focus more on their preventative care. Just a little word cloud. I usually talk about this with folks. Of all those things on there, has anybody heard those when you go see your physician for that annual physical, perhaps? That you should do a little bit more of some of the things on that list or a little bit less of some of the others. My point just being, these are very familiar things to many of us, and hopefully to those of us here today. Not the easiest things to do sometimes. We'll talk about changing lifestyle and habits, but things that are achievable if we're willing to put forth the effort, and sometimes with that effort comes a little bit of support in accomplishing that. So why did I share all this information with you and put that on the slides? And here's some of the key points that I want to share with you to that. How does that boil down to impacting your responsibilities as the Board of Supervisors or local government, county government here in your community? True of every other set of commissioners that sit in your seats in the other 104 counties around the state, and hopefully the counties across the country. But reduce productivity of employees. So you're an employer of some number of people as county government. I hope that is something that's on your radar and that's important to pay attention to. Are your employees healthy and coming to work? Using less sick leave, off work less time where you're losing productivity. Then that also translates to every employer in this community. If the community's healthier, there's a healthier body of employees, workforce to draw from. So whether that's the bank here in town or any other business, if their employees are healthier, they're at work, they're more productive. That helps drive lots of positive things in our work, in our world. Increase healthcare premiums, costs and premiums. So that cuts a few different ways, but again, you're an employer, you have healthcare costs. I'm going to guess, and I think I saw some of your budgets this year, those are going up pretty significantly for you, which is pretty common for any employer. So if we're healthier, we consume less of that care. Insurance needs to cover less costs. It helps mitigate some of that cost. If we can ever go backwards, it's probably unrealistic, at least in our lifetimes. Exiting from the workforce at a younger age, leading to fewer participants in the workforce. I noticed on some of the history out here on the wall, when this county was formed early on, there were about, in one census, about 2,600 residents, it looked like. And I think I saw you're somewhere around 1,200-ish today. Hope I'm close on that number. That's common for the last 100 years in all but maybe 10 or 12 counties in Kansas. My family's from Comanche County. That's where my roots are. It's much like this county. It had probably 2,500 citizens 180 years ago. It's about 1,500-1,600 now. That's just normal. Society has changed. People have gravitated towards the cities. We've changed. So that's where the employment sources more likely are. But it is really important that we have a workforce in all communities in this country, including places like here in Greeley County, Truth. So if we have folks unhealthy and they have to go out of the workforce in their early 60s, their 50s, even younger, that's a drain on the economy. So those investments that help people stay healthy, help them stay in the workforce. And so if we have less people, ideally or optimally, how can we keep them healthy and in that workforce for a longer period of their lifetimes that they're productive is important. You fund many things as a Board of Supervisors, and you have to make many choices about how to most effectively and with the least impact to the pocketbook of your citizens use those resources. Healthier people have less demand on things like your hospital or your health department. social services that you may fund for your local budget. And of course, your citizens are paying for that through their state and federal taxes very significantly. Your area agency on aging that covers this area and others. If we can be healthier, we can reduce the demand, we can reduce taxpayer costs in the long term there. Economic productivity, lower business output. We talked a little bit about people being able to come to work, go to work, being healthy, but that then translates to economic activity, which it translates to tax revenue. So if folks aren't working as many hours, they're not probably buying as many products, so you're not generating as much taxes from the products they buy. Property, I don't ask or look up if you have sales tax in this county, maybe you do, maybe you don't. But all your tax revenues can be impacted by less economic activity. So keeping people healthy helps drive that as well. Spending less of their portion of their income on healthcare. Probably every one of us here has a health care plan of some type, whether it's through our employer or if we're self-employed, we've acquired ourselves or through a spouse. Those out-of-pocket costs, those co-payments, co-insurances, the premiums themselves. As the costs go up, employers very typically and insurance companies certainly pass that on to the consumer. That doesn't come out of their profit margins. So if I have to spend more money on my health care because I'm not very healthy, I'm spending less on other things I might buy in the community, whether that's needs for the poorest among us, and simple things like food and paying for their housing, or those of us who have a little bit more disposable income that we may spend on other things that again drive the economy in the community. If I buy a new pickup more often or something like that, I'm generating revenue for the community. And then over time, the last bullet on here, and from what I know of this topic and the research on it, it really takes decades for this to happen. It's changing it decades. But if we have a less vibrant community, ultimately in time, businesses aren't going to be able to thrive in a given community. Businesses are going to fold. Businesses are going to relocate to larger communities and larger metropolitan areas. Then we see the decline in the tax revenues. So the property's worth less. Then the appraiser notices across the hall over there. The appraised values come down. The tax collections for value come down, which means those of us who remain in the community will pay a higher share because the value, we're still here and the valuations are less. So I hope all that is at least a helpful background to think of it. Again, that very large picture of public health isn't necessarily the thing that might, in a budget process, which you're going to be beginning for the next year here very shortly, I believe, and you go through that process through the summer and this fall. A lot of what I've talked about so far is really big picture, long-term investments. I have worked for the people since the late 1980s. Began my career in state government in the mid-90s and was in many, many different roles, but I was formerly the Executive Secretary of the Kansas Department of Corrections. So I've seen government services from my first part of my career as a staff person to the executive level of the state agency. It's quite large and spends about $500 million of your tax dollars every year. There's many, many challenges and we're confronted as we serve people in appointed and elected positions with how do we prioritize our resources. And there's not enough resources to meet all the needs. And I 100% know what that's like from my past, and I respect that you as the elected leaders have to make that tough decision. So whether it's this needs done right now in your community or this needs done next year, that's a tough balance sometimes with investing for the long term of public health of your community. I just encourage you to make that a priority however and whenever you can to try to set up for those men and women who are going to sit in those seats out 10 and 20 and 30 and 50 years from now. In part, public health is a long-term play to help for the future. So I just want to leave you with that thought on that part of the presentation. I will take questions at any time, or I will keep going, but I'm in section, so I'll just pause if that's helpful.
Any questions?
Chairman and others?
Comments? Randy?
Very good.
Randy, just one question. You said the there's 100 departments serving 105 counties.
Yeah.
What are the other 5 counties? How do they handle their?
Yeah, there are two regional models. One's called SEK, Southeast Kansas, that is 4 counties, and one is Northeast Kansas, NEK, which serves 3. So all 105 are covered.
Okay.
And how that is puzzles me. I mentioned my background in state government, but I retired from there and came into this role about 18 months ago. I am very used to regionalized government services coming out of that field. Like your judicial district folks also across the hallway, I worked with those folks most of my career in one form or another. We're not that way in public health, but those two, particularly NEK, I have found references to that multi-county organization in the founding Constitution and documents for CALL, the organization I now worked for in 1979. Were there others? I haven't found any of their history, but it's interesting to me that there's 2 regional ones, and they're not new based on new needs and new economies. They've been around for 45 plus years. Why are they the only 2? It's a puzzle I hope to learn more about across time.
Okay. So I guess assuming that it's the state statute that you're required to have county health.
Yes.
So I guess they cross those hurdles
Yes.
by regionalizing.
Yes. Yeah, we're going to go through some of that in these
Okay.
roles responsibilities, but yeah, there is and I couldn't quote you the statute number on it right now, but there are statutes that permit counties to enter into interlocal agreements for various functions and to kind of regionalize themselves. It's just not normal in public health. So.
Yeah. Okay. Thank you.
Thank you, sir. Okay. Roles and responsibilities. So just start with a little background. So again, investing in public health is one of our most impactful ways to reduce long-term costs and support economic growth. All of us want to live in a community where good neighborhoods, families thrive, children succeed at school, business flourishes. That also helps kids grow up and go, okay, I want to stay in my community. Maybe I go somewhere to get an education, but I want to come back because that's where I grew up. I have an attachment to that community and want to raise my own children. So I think that's a goal we all share, whether we're from Eastern Kansas or Western Kansas. Prevention saves money. There's plenty of studies out there and plenty of different figures you can look at, but I've never seen one that was contrary to the point on the top here that every dollar spent in public health on things like vaccination, nutrition education, clean water, et cetera, does save significant monies down the road. Some of those ROIs can be 1 to 4, 1 to 5. Some of them can be 1 to 15. Just depends on what's typical service, what type of service, and sometimes individual studies. Fewer or healthier workers means fewer sick days. I've talked about that a little bit. Crisis readiness. Public health helps ensures we're prepared for emergencies like pandemics and natural disasters, reducing the loss of life and economic disruption. Let's all pray we don't live what we did in 2020 and those 2 years again in our lifetimes, but there are other things that can impact us in the short run. Near term, your colleagues up here in Goodland area had one of those just here about 6 weeks ago, I believe, when we had the 80-car pileup on I-70. Now, you don't have that kind of traffic coming through this county, I don't imagine, of Interstate 70, but that was a public health emergency response along with a lot of other emergency responders to go out for that traffic accident, render aid to those who have been injured or worse. I think there was 8 total deaths in that incident. So public health plays a role in that type of response too that can happen on a given day at any time. As we have more and more dry weather out here in Kansas, I don't know if you've had them so much in this part of the state, but from East County, where my family's from, they've had 2 wildfires in the last 10 years. Hadn't had them in my parents' lifetime before that. Those are extremely devastating to the economy and to every farmer that had lost cattle and fencing and all the other infrastructure. That's part of readiness is how would we respond if that happens in a community. And just access to quality of life, tools we need. So here we're going to transition a little bit. Again, not legal advice, not an attorney. Thankfully, I never got that bug to go to law school. None of you are attorneys. I didn't just insult them. it's an important profession, my choice. This statute, KSA 19212, there are many, but this is in the chapter that begins to define how the counties are structured in Kansas and the basic core functions of county government. And this particular statute is actually the 11th one that goes through there, but the actions you can take in any board, so it's board meetings, so it's things you can do and really must do in many instances to protect and promote public health and welfare. It's in the core, if you will, statute as a function of county commissioners under Kansas law. It's been there for many decades. When I've done some research on it, it actually doesn't go back. This law does go back to the late 1800s, but this one was added in about the 1950s. This particular provision. Again, I don't know the history of why it wasn't part of the core for county government from our inception as a state, but it's been around for decades. This is not a new requirement. Then you get into 65-201 and some of these others I'm going to go through here. This really gets into the nuts and bolts of specific public health obligations that commissioners have for their citizens across the state of Kansas. Some of these, particularly this slide, are going to fall directly upon you as the county commission and board of health. Others, though, very quickly fall under local health officer and your health administrator. So Lisa here in your community then carry that out. But as the executives for the county, ultimately how that is carried out is ultimately your responsibility under operational realities and the law in the state of Kansas. So you act as the county board of health. You know that since this is your annual board of health meeting, so that's great. In that role, you have responsibility to oversee everything and make decisions, and you do have even more decisions to make based on laws that have been passed here in the last about 4 years. But first, you must appoint a local health officer to advise the commission. And then I put these bullets in here, knowing this is a very small community compared to everyone else. I guess you're the smallest one, I believe, as well. But when you're less than 100,000, which of course you are, you can appoint a health administrator as the local health officer. So that's really important to think about in that, okay, that is your advisor when you need to make decisions as the Board of Health in a time, in day-to-day, at a time of crisis especially. So it's based in statute, set up to be separate parties, separate roles. Now, maybe there are commissioners in the state who are trained in the medical field, and that makes sense. But I would say also, the same way you don't probably want to be your own attorney, you probably don't want to be your own health officer. You want an expert in that bringing you and giving you that advice. And then when you have to make that community level decision, that might be agreeing with the health officer or might be factoring in other equations, and you have to look at it differently. It's hard to advise yourself sometimes. So it's really important to have that separation there for that health officer. Then it goes through the qualifications of that person. Your administrator does not have to be a physician, but then you need to have a consultant for that health officer as soon as your structure is. Of course, that health officer that you appoint serves at the pleasure of you as a commission, like technically every other county employee does as well. So you may review, amend, or revoke the health officer's orders or orders by the governor. That is a change that you might be aware of out of the pandemic. There was a special legislative session held in the summer of 2021, and this piece of law, this particular provision of 65-201 was modified to what it is today out of that special session. Say we did have another worldwide pandemic like that. Again, pray that we don't for those of us in our lifetimes, but if we would, how this is going to play out will be different and interesting in this way, in my view. We're going to have 105 county commissions make 105 different decisions. There won't be 105 different ways to make it. My illustration for that being, your county might make it this way, the one this board might do it this way, the one here might do it differently. Probably not 105, but you could end up with half a dozen or dozens of different ways of approaching a response. Yet I drove across, I would have to stop count how many county lines did I drive across today when I came out from Topeka this morning, and I made a couple stops along the way. So in our modern society where we all jump in a vehicle and go somewhere, we share our germs everywhere we go. So having a one by one scenario will be different. Maybe it will work better. I'm not able or going to even attempt to judge that. But my point for sharing it with elected officials is this: that's going to fall on you. You will be expected by your citizens to make that decision. If your citizens disagree with one that's made at either the federal or the state level, you have the authority to override it. So you're going to get that question and have that expectation from your citizens going forward. So you're going to need good advice, both from your counselor when that time comes and from your health officer to make the best decision you can for folks. Then lastly, with that, there's a piece in that in 2021. Then there's a new bill, it's called Senate Bill 29, was passed this year that did a few more pieces. Everything you do as a health board, your health officer, your administrator, in responding to contagious and infectious diseases, things like TB, measles, etc., will now be subject to being taken to court by anybody impacted by it. There's some of that in the past, now it's applied much more broadly. So the last bullet here just to remind you, or let you know if you didn't already know, you have a response to defend those actions too. So you're going to have to fund Mr. Mosier or others or give enough time on his schedule to defend those should that be necessary to go to case. So again, go important. Again, important to have that separation of duties in that regard. Then through your health officer, not you directly, but that person you appoint, here's a beginning list of the things that person is responsible for. And I stuck to with these slides. This is statutory framework. With all of these, there's a pretty significant regulatory, cancer administrative regulations that go with these and add more context and more responsibilities. But keeping it at the executive management level, your health officer needs to keep the records of the office, turn records over to their successor if they retire, move on, get a new job. They need to account for all the public funding that's coming in. You know, that county governments that I've got familiar with, this is not all of them. That's usually done by somebody else, clerk, treasurer. They're responsible for county funds. There's that interaction and working relationship that has to happen in the health officer and the person who manages the checkbook, so to speak, for the county. There's responsibilities to notify the secretary of KDHE on different things. There's forms from KDHE that need to be distributed here in the community, so healthcare providers are aware of their responsibilities and they can report things. Sanitary school inspections, that's a requirement you have for your health officer unless you have exempted yourselves out of that. That was a law that we got revised just last year in the 2024 session. In 2021, they wiped out decades of home rule authority you had as board supervisors, as county commissioners, to exempt yourselves from that. Caused a lot of consternation with schools and with our health departments, and we were successful in getting legislature to basically reverse that last year. It does require you to go through a particular statutory process for a county resolution to exempt yourselves from that. That is one you can at least do that with. Investigate contagious and communicable diseases. Those don't happen every day, but they do happen more than probably many of us realize. I took a look at some data last summer from KDHE just because it was a question in my mind. In the prior year that I looked at, that was in 2023 at that time, every single county in the state had a communicable disease of one person or more at least, and they protect the data under 6. They don't even put a number to everything on the map says 6 or 1 to 5. So it happens in every single county, presumably almost, if not every single year. So having some infrastructure to do that is just a core requirement of local government. Perform other duties that you may assign to the local health officer, and then they can, with your, of course, approval and your funding that you grant, they can hire the personnel deemed necessary for public health. Infectious and contagious disease responsibilities. So somebody goes to a physician clinic office. You have the hospital I saw over here. I drove by. I imagine you have a practice outside the hospital, but you may not. Maybe people always drive to another community for that. Let's say they drove up to Goodland to see a physician. a physician diagnosed a contagious disease, because they're a resident here, that's going to come back down here to your health department to do that disease investigation and that stuff. So you need to assume you have that responsibility. And then maintaining supervision of that person or persons through the care and treatment and making sure they get care and treatment for those diseases is your responsibility. School related, I mentioned the sanitation, but there is also in statute a requirement for purchase of vaccines for students. And then there's one for health assessments for students on the sliding fee scale. The vaccines one, now, hopefully, and I think that's the case for your health department here too, there are some grant sources that they can tap into from the state government and federal government to help offset those costs. But if those were not there, if the state government or federal government cut those funds, it would still, under law, then fall upon you to finance that with county dollars, unfortunately. So that's an interesting conversation with your elected peers in other offices of what might they do to their budgets that impacts and rolls down the county. I know you're very familiar with that. For everything that you do, you deliver the services. State government in Kansas less and less deliver services. They provide money to counties. Never enough money to do the work, but they have the expectations still. That's always a balancing act. Then also, many students, they'll get that covered through their parents' health insurance plan. Great. Then you're not on the hook for that. And they should be using those resources. Same with the health assessments. But when the family can't, it does fall upon you. And in these two instances, not the school, which of course is another political entity and taxing entity with their own revenues. Some health departments, some county commissions have made the decision to kind of share nursing staff between schools and the health department. And it seems to work okay in some places. So it's not, I'm not saying it's a bad thing. I'm just saying if you do or ever do that, make sure you work with your counselor, please, and make sure that you know this is your obligations and this is where you're apart. What I mean by that is, for obligations, you have the taxing authority and the taxing obligation to provide the resources. Don't take on things from your partner that they should be using their tax appropriated resources for. And have an agreement. Okay, if we're going to do this, then they're going to pay you this much for that, or vice versa. Don't take on another taxing entity's obligations. It's my not legal advice, just management advice. Abatement of nuisances. Okay, can't get that word out this morning. But there's statutes to allow your health officer to look at those to see if they need abated. Sanitary codes is a may adopt. Many smaller counties have not. I don't know if you have or haven't in this community, but if it's a provision, you can do that. Those are important too. Do we have safe water? That goes to health. Do we have good disposal of sewage so that it doesn't get into our water supplies? How is food handled in restaurants and places like that? How is our trash collection taken care of? Are all important part of health as well. So within that framework of responsibilities that our elected officials defined across the period of time of state government, you as the commissioner are uniquely positioned to make this actionable through the structure I've shared with you a little bit, through you as the Board of Health, through the decisions you must make as the Board of Supervisors, and through your health officer and your health agency in your local health department. More importantly, you're the leaders in this community. The people elected you for a reason. Whatever your backgrounds are, as professionals, they saw you as somebody they were going to vote for on the ballot and ask you to make those tough decisions for the other citizens of the community. So that's a unique platform in that you can help the community gain greater understanding of why you make a decision in a particular way sometimes. What you're accomplishing and trying to accomplish both short-term and long-term through a public health lens in this context. So whether that's your policy leaderships, when you sit down as the five of you and decide what's the right policy as your community, how you allocate your resources each year in those tough decisions that you have to make, your engagement and advocacy in the community for the services for public health, partnership building. Sometimes there are folks who are willing to donate time and assist with things, so that helps offset costs. Sometimes there are people who are well-resourced enough, they'll even donate money. There's some private county foundations around the state sometimes that help us. Bringing things together in emergency response and leadership. So I mentioned there's a public health response, and your neighbors to the north, public health was involved in that, emergency management involved in that, law enforcement, countless others. So you can be a body to bring that together and championship that happens. Champion equity. I'd ask you to think of it this way. Should every child in this community have the best chance to grow up, get an education, be healthy, get a job, contribute to the community, raise a family if they so choose? I hope you might say yes if I asked you to respond to that. That's what equity is. It's not so much some of the other things we read in our modern society and some of the controversial things for some other folks. It's simply we have a fair shot at life and have a good chance to contribute to society in an equal way. And I'll pause on that. Any questions there? And then I will keep rolling. Gentlemen?
Questions? If you're good.
Operationalizing public health, be a local health plan. So rubber hits the road, so to speak. I mentioned this earlier, so I won't talk about it other than the second bullet again. Kansas is what we refer to as a decentralized public health system. That, in the simplest terms, means Kansas Department of Health and Environment, the state agency with a cabinet official appointed by the governor. They don't do the public health work the local health department does. And they champion that. They talk about that in the legislature, that they're not the decision maker. But I push back on that in this way. They're the ones over at the legislature and with the governor advocating for resources that are going to funnel down to you at the local health department level. And when you have the purse, you often set the rules. So there's a very important role that they play in a decentralized public health system in that regard. And then secondly, in different things that we just could never humanly do in most counties in the state, not just Greeley County, but even counties that have much larger population bases, because it just doesn't make sense from an economy of scale perspective to do it at that level. So things like a statewide laboratory, there's one of those in Topeka. If you paid attention to that, they just legislature appropriated some money, I think about 3 years ago, but it just got finished this spring and just opened here about 30 days ago. All lab samples can be shipped from a courier from your health departments, but also your water departments around the state use that. Some other state agencies use it, not just public health, but it's sending biological and water samples to Topeka to that laboratory to be tested. Doesn't make a lot of sense to try to have 105 labs. It's a very specialized set of work. Extremely expensive to do at that scale. So that's where KDHE is a leader and plays a key role. And that's just one example of it through that laboratory. I'll put in a plug and ask maybe if you talk with your senator or your representative from time to time, if you might be kind enough to put this in their ear as well. That courier, which runs through all the counties in the state multiple times a week, picks up the samples, gets them to Topeka, is a contract by the Kansas Department of Health and Environment that they have been funding with federal funds that disappeared March 24th. They are, as they describe it to me, they're making it work for now. I think they're trying to build a bridge to the Kansas legislature in 2026, which of course recently adjourned. But without that funding, the state legislature is unable or unwilling to step in at some point. That's going to be another of these kind of unfunded mandates that's going to fall on county government. So if you could or would, if you'd be so kind, kind of mention that to your lawmakers at some point. If you agree with that comment, I'd appreciate it. It's work I'll be doing again next session with others in Topeka to try to get them to realize that your taxpayers are paying for that nice laboratory for those services. Why would we have county government paying for the access to it when hopefully the state of Kansas could, would, and should? The state funds that the federal government's going to no longer fund it. Put this slide in there just for a little context. What it is the staffing levels of the health departments around the state. The bottom number of FTEs, 1,457 across there. Of course, you're small, the lightest color. Now you can also just take those numbers off and overlay this with what's the population of the state of Kansas and where are they? It just perfectly overlays. Johnson County and Sedgwick County are, of course, the two great big counties with 600,000 populations in both of them in that ballpark. They have the most health department staff and everywhere in between. But I included it in here because I think it's important. You have a lot of folks who are working with a system very similar to yours, 1, 2, 3, 4 staff, trying to serve the needs of the citizens in smaller areas of the state. Complementary roles is how I chose to title this one that I've used. Question comes up time to time, different settings, but local public health departments and hospitals. Typically, and this is very much the customary way of structuring things in Kansas, those are separate entities. There are a few counties where they have those together. It's about a half a dozen. But that's not normal. You have the normal business model where they're separate. That's also the normal business model all across the United States. Health departments are really primarily focused on that future that I've talked about throughout my remarks today in this conversation. Education to change the behavior, avoiding future costs and impacts, very future oriented. Hospitals, while healthcare as an industry has been shifting in my lifetime at least, where you go to the hospital, they may ask you some questions. They ask about social determinants of health, which is one of our buzz terms about are you safe in your home? Do you have a place to sleep? Do you have food? Do you have supports? The hospitals are really fixing the ailment that I go in there for, my injury or my illness. Get me fixed, get me back to being as productive as I can. That takes a very intentional set of efforts, a very intentional culture to help that happen. Where public health is intentional in that more preventative way rather than I'm going to diagnose you and fix something. But there are things that go across that. That's why there are a few that have gone to kind of a combined model, but again, it is not common in Kansas. In services. So this chart is kind of hard to read because there's a lot on here, but the big blue bars is the things that a couple of health departments do all of that. That's emergency preparedness and disease response investigation. And then almost all do immunizations, almost all do health education and health promotion is the top 5. A couple do hospice, one or two does sexual assault nursing examinations. That one is right here north of you, in fact. That's more of that administrator has that skill and background and helps the sheriff out. The point for this slide is being every health department is structured in a way that makes the most sense for its community and its resource needs. In partnership with your hospital, for their funding, they do health assessments every 2 years, every 2 or 3 years. Optimally, your health department will be part of that conversation because they may identify things in the hospital as a needy community. Your health department is one tool in the toolbox to help work on those needs. Then it falls on, of course, the county commission to finance the operation. County tax revenue, whether that's all property tax or sales tax. Counties may establish a specific health fund under the statute that's on there for those purposes. It's not very typical to have a special fund in the rural ones that I understand it at least. There is some financial assistance KDHE sends to you under 65-242. That's not enough to run your organization. That's $12,000 for the smallest counties. So yours is $12,000. Other state and federal grants, fees for services, that's the things like private insurance if the person has insurance, Medicare if they're elderly, Medicaid if they're younger and on that program, sometimes some philanthropy. Here's a pie chart that just reflects that. This is from 2025 data. This is gathered by KDHE through Wichita State University from health department administrators annually. It is self-report data, so it can have some differences in it in that how people interpret it or applied it locally. But generally 39, call it 40% of the revenue for health departments coming from your tax base, your tax revenues as a county on average. The rest of the pie chart is to your advantage when others are participating in the costs to the public health system. So to the extent the federal government either chooses to continue to provide funding that they have in the past, or might one day choose to provide more that benefits you at the local level and your taxpayers, less property tax because you can get it from somewhere else. Same with aid to local growth funding. That's all the state funds. There's the one that's in the statute I mentioned, and there's some others. But as long as the Kansas legislature recognizes that they do put mandates on county commissions, and then they find ways to fund those mandates, which they don't do really well, I understand and trust. But that advocacy that they need to be doing that is important. It's almost 20% on average of health department budgets. Fee for service, so that's, again, it's insurances, whether they're private or publicly funded that I mentioned. Those are really important because if you don't have the right infrastructure in place, the supports of your health department staff, that's a very specific skill. Your hospital folks will know that as well. Billing insurance is its own language, its own process. Doing that effectively and well is important to generate revenue and have that come. If more people in your community have insurance, you're going to have a better fee for service claims. If you've got a large uninsured population out here, you're of course going to struggle with the latter. I hope you've seen this graphic from your KAC membership. I don't believe when I looked here, county has submitted a response to the survey, so there's a plug for my colleagues back off the KAC. If you would do that, they still are taking data, but they're trying to help. And I'm trying to help them with that as well. Help the Kansas legislature understand the cost of local government services and how it gets arrayed out. So in the top right there is public health on the statewide level for 35 counties that participate in the survey. It's about 2.7%. Public health has had some interesting funding streams the last 5 years because of the state and federal responses to COVID. There's lots of influxes of money, and so it's very irregular. And I try to encourage people, I don't compare year to year to year because of that irregularity. We'll probably get back to something more normal in the future. So whether 2.7 would have been that 3 years ago or 5 years ago, it's been variable for certain. Where some of these other county structures and systems are probably a little more consistent across time. Get closer to the end, gentlemen. So your local health department, really at the end of the day, what they need is adequate staffing and resources to do the work. They'll include that to suggest that you need to provide every resource that everybody might need. That's not the role you have. That's not the role they have either. Resources are a precious commodity in every system in our society, and they are not endless. But they do need adequate supports to do the work. Workforce development. So they need training. They need to keep their skills current with changes. They need to gain new skills, particularly in small health departments when you have that 1, 2, 3, 4 persons, whatever it might be. They're really wearing many hats, each person. That's just organizational dynamics. If it's a very large organization, you have people that specialize on A and B and C. That's not reality for most county governments or health departments, and certainly not in the smallest one here. So there's a lot of training that's needed over time. Some of that is offered and can be done virtually, but not all of it. There's pros and cons to virtual and in-person trainings, and I would suggest to you that depending on the training type, some is better in person and some is better virtual. And then sometimes you go to those trainings, you're like, why did I go to this? That's adults sometimes too, but it's very important we keep up on that and provide resources to help that happen. Help build trust. Again, you are the leaders of this community that your fellow citizens put in office by you putting your name on the ballot. You can go a long ways to helping them trust what you are doing as a governmental entity and what your public health department is doing as part of that entity. Help combating some of that misinformation. The internet has some wonderful things about it and some that I would offer my opinion that aren't so good, and one of those is social media. There's a lot of stuff out there that we all have to struggle with. So working on that as government, I have every reason to imagine this government runs very efficiently in this county and does everything it can with its dollars, but you will have people out there blasting on social media who will take the contrary opinion of it. Balancing individual rights and public health. That's a real challenge, and our Kansas legislature struggled with that again this year. But we all, as Americans, have that as a sense of our being and how our government is set up in the United States. So it's about the individuals, and government is not in the lead, we're in the lead. But particularly in public health, we have to balance that real carefully. The pandemic wasn't the best example of that. But if I, as an individual, make a decision, I'll just use measles since that's coming around in Kansas right now. It's not up here yet. Let's hope it doesn't get here, but the odds are it's going to. If I make a choice not to vaccinate myself or my children, that's a choice. I have a right to make that. I 100% respect that. But when then I get sick, who am I around and who do I infect? What's their individual rights to not get sick from me? It's a very important and thoughtful balance that we need to find in our government structure and in public health in the United States. Summarize, so economic benefits, talk a lot about that. But again, we can make those long-term investments through our various governmental entities. It will save both governmental funds and private sector funds and individual citizens' funds and expenditures across the decades. Quality of life or health is all about. If you are unable to get around, unable to do the things you love, get out and enjoy the outdoors, do things with your family, whatever, it has an impact in so many ways. And being strong and resilient communities, being prepared for those disasters, pandemics, should they come again, other emergencies that have a huge impact on our livelihoods and ultimately on our economy. The last slide that I had for you today, and I'll leave a copy of this electronically, but those are hyperlinks to the National Association of Counties, some of their initiatives in public health. Or you could just Google those terms and they should come right up for you. But your national groups, not just Kansas Association of Counties, recognizes the importance and value on the responsibility of community health and of public health, and there's some things that they're working on. Public Broadcasting Service, the Invisible Shield, it's 4 components. I think they were all roughly an hour or so. It came out about a year ago, and that's when I watched it. If you just have an evening where you can kill a little time in front of the TV, you want to watch something and learn about the history of public health and its importance, it's really well done. It's a documentary style kind of thing. I did not bring a copy of the handouts, but I do statutes, but I have them referenced in the slides. KT website, it is huge. There's all kinds of things out there. The Kansas Public Health Collaborative website. The service data I had on my slides and the staffing levels and some of those things are on that site. You can go to it. You can look at any county that you want. So if you want to see how your neighbors are doing things, you can go learn about individual counties. And then, of course, our call website, which is really geared for administrators, but it's there with resources you can easily access at any time that it gets thoughtful for you. I definitely would take questions. I'll stay for other conversations, but that was my formal remarks, and I appreciate the time, John. How can I help you?
Well, Randy, thanks for your comments, and we appreciate you especially taking the time out of your day to make the trip from Topeka to Western Kansas, and we appreciate that. Any comments or questions for Randy? He's here. We could throw arrows at him, or we can whatever.
I'm used to going more public bodies and getting here.
There you go. No, and you really summed up a lot of things and covered a lot of information, Randy. You know, one of the things we struggle with when you touched upon is just being able to afford within a budget good, strong public health for the return. You know, sometimes when you give money out, you got to think, is it an expense or is it an investment? And so those are things that are tough for us to decide when there's not cash flow coming back in. But so that's one of those one of those decisions that's tough for small communities, especially, and where we're small staffed, so many things, and I believe in continuing education. And the grants, some of the grants cover that, continuing education. But what we struggle with is when our local staff is at continuing education, we're not being able to serve the public at the same time because we're just one or two. So those are some of the things we struggle with, but we appreciate your comments and your oversight on what you told today.
Thank you for that, Charles. It's not easy work that you do, but thank you for doing it, Jim. Good.
Anything else for Randy? Thank you, Randy.
Thank you.
Appreciate your time. Have a safe trip back. And we'll, if we need you, we'll call you.
Absolutely. Thank you, Judge. Pivot here.
Okay.
So thank you, Randy, and we also have Dr. Robert Mosher here to speak. He has a unique perspective where he has worked in our community, grew up here. He has served as the secretary of the Kansas Department of Health and Environment, and continues to hold leadership roles at the CUNY School of Medicine and the CARE Collaborative and the Kansas Clinical Improvement Collaborative. And I just asked for him to speak with you as well.
Okay. Welcome, Dr. Mosher.
Thank you. Thank you.
You know, I've told many people that you were my physician for many years. So if you have Dr. Mosher looking after your health, this is what you get.
Well, still above ground. So
Okay.
That's good. That's good.
Welcome back to Tribune.
Thanks. Yeah. Well, I had a 60-slide presentation for you today. But, I really just wanted more kind of conversation to kind of back a little bit of what Randy presented to you guys. So, first of all, thanks for the opportunity to talk to you today, and thanks for what you do. I know that it isn't always appreciated, which is kind of the realm in which public health exists, because it's not very flashy, but it's important. There's a lot of roles and responsibilities that public health has. As you saw, when you look at one community and you look at their health department, or even when you look at their health services, unique to each and every environment. And so oftentimes what they sink their teeth into, what they're working toward, it has a lot to do with the community health assessment plan. I think if you look at the history of our health department here, that's kind of been their backing. You may remember for a time, I was the only physician in Tribune for almost 3 years. And during that time, one of the things that I came to actually rely on the public health department was vaccination program. We were giving a lot of those, obviously, after well child visits when we, were seeing babies we delivered. But what I found was I didn't have time trying to see 40 people a day, covering 2 clinics, covering the ER, nursing homes, was to put up with kids who thought every time they came to the doctor's office, they were there to get a shot. And so, to kind of push that over to the local health department really just made perfect sense. I mean, that was really kind of one of their main areas of focus, as well as kind of disease investigation, community health, and whatnot. The other thing was recognizing that the importance of having patients prepared for managing what happens during the delivery and whatnot. So we relied on the local health department to put on the Lamaze classes and whatnot. And oftentimes myself or later on providers would also contribute to those lectures and such. Now, some times have changed, right? It's not exactly, doesn't look the same as when I grew up here, with just Glenna. And Glenna was kind of school nurse, local health nurse, and just kind of quiet. We didn't hear a lot of things going on, but as times have changed, so has public health and public health services. Randy pointed out that the state, obviously passes lots of laws and mandates, so you have some statutory requirements, and yet they don't always follow with funding to do that. And I can tell you when I was at KDHD, one of the things that kind of bothered me a little bit was the state funding out to local health departments, which was based on population of the community. And at that time, the small counties, like Greeley County, only got $5,000 a year. So they've more than doubled it, but still goes far short of covering a lot of the expenses for what public health does. Now, a lot of the other roles and responsibilities for public health tend to be categorical and funded accordingly, like the vaccines for children and other maternal and child health and other programs like that. So the state has a process where the local health department each year basically gets online to kind of grants management system, and they apply for what funding they need beyond what the statutorily reimbursed or funded public health services are. And with that, there are lots of responsibilities. If you pointed out, one of the things that I've been involved with since I been part of the KU Health System, the Care Collaborative, we work with 75 counties across the state, mostly taking current evidence-based guidelines and helping them put that into practice, and so that they're improving care for mostly time-critical diagnoses. But what we found was all of the grants that we've written to expand those services were based on what our local partners and communities felt they needed. For example, one is telebehavioral health. Mental health always pops up in the top three, really, of all the community health assessments across the state. And a lot of our practices found that very challenging to deliver. So starting in 2018, we were working with 11 counties to help bring in telebehavioral health into the communities. So patients could go to their local clinic like they normally did for medical care, but they were getting access to behavioral health services. But all of those grants require that we go into the annual meetings to learn about the grant reporting requirements, operations of the grants, how to extend, if we didn't spend all of the funds, how we got a no-cost extension to go over a longer period of time. And we knew that kind of going in, obviously, my work at KDH&E. So when we started with the Care Collaborative, one of the first things that we decided when we began with just 13 counties in Northwest Kansas was that we weren't going to expect the providers, the nursing staff, and whatnot to load up and come to a regional meeting, because that took them away from the day-to-day clinical care and services. So we've done, for the last 10 years that we've been doing this work, going out and actually doing the training in the community. As a matter of fact, that's kind of what I'm on right now, is my circuit to do a couple of communities this week, meet tomorrow in this city the day after. And we found that that's much more effective. And unfortunately, even when I was at KDH&E and all the various programs that operated under the Public Health Division, they're basically told by the feds how they'll operate their grant programs, which oftentimes involves having these regional annual meetings and whatnot. So they are a drain on services when they have to be out for that. There's no doubt with that. But unfortunately, neither the state nor the feds have quite gotten it through their mind that Kansas is a big state. And when you look at rural communities like Tribune and you've got one or two people in the office, you take one of them out or two of them out, you're without services. So I would hope that eventually they'll figure that out. But 10 years I've been working on trying to get that across to our federal partners. That's not made any bearing yet. So I can understand the challenges with that. Now, in my role as Secretary of KDH&E, I can tell you that twice I was asked to come out and talk to rural communities about there were challenges in delivering public health services. And both times they were losing their local public health nurse. Now, if you look across almost all of those counties that Randy was showing you that have local health departments, the majority of those public health nurses didn't go into nursing thinking they were going to become public health nurses. Most of the time, that's just kind of the role that they've fallen into. And so they often don't have a great deal of public health training. Really, in medicine, for the most part, unless you're in family medicine, primary care, you don't get much public health training. So the workforce development training, I think, is important, particularly around a lot of the funding and financial responsibilities that the local health department has. So I certainly understand the importance of having to be off for that training. Now, some of it could be done virtually, but that's partly why I still go out and do these trainings. Now that we've got 75 counties, you can imagine that our partners with the Care Collaborative, I'll be doing a training somewhere across the state of Kansas at least once a week. And that's just because we've tried the virtual training. You don't get much engagement, particularly at providers. They seem to be busy checking their email or writing their clinic notes. And even nursing staff is challenged in getting time away fully devoted to the training. So being out into the community, we do 2 trainings a day just so that we can catch both shifts in facilities. So it's kind of the same thing with public health, having done a few of those online trainings. It's helpful. It does fill a gap, but it's not a very effective method of training. Dartmouth did a study looking at how effective is that type of training, or the training where we expect these folks to go to a regional. Most of the time when you're talking about a system and you have someone who goes off to do that training, when they go back, what % of them actually incorporate what they've just learned into actual practice? And it's actually less than 10%. So that's kind of why I really feel strongly at the value of doing training in person and such. But of the communities that I went out and talked to that were looking at the change in their local health department, what options they had, most of them were looking at the combining of the hospital and the public health department. Now you've got one that's not too far from here up in Cheyenne County with Jeremy Klingenfield. Trice knows, I'm sure. Jeremy, we used to live here in Greeley County, so he can be a great resource, I think, for you to talk to. But what you'll find, in particular, the 4 counties where they've combined the local health department and the hospital, they literally have become what they were. In other words, the local health department is still operated by the local public health nurse. Typically, they have a receptionist, and they have an office that may be on the hospital grounds. They have an office that operates like a local health department. So not a whole lot has changed, but most of those hospitals, the 2 that I know of, that I spoke to that have gone that route, the one thing I think that the administrators would probably tell you is that they wish they would have asked for more money to operate the local health department alongside with the healthcare system. So there's some opportunities to look at different models, but for the most part, I think you look at the majority of the state of Kansas being rural, the majority of the local health departments have remained separated. So that was really kind of the highlights of what I wanted to talk about today. Maybe more than you wanted to hear or longer than you wanted me to go, but really just wanted to be here to answer questions or to just stimulate conversation.
Randy or Dr. Bob, either one of you, is of the departments around the state, is there any that share some task with our local hospital, local clinics, where they work in partnership with part of their services?
Not a lot. They will definitely share the information and the outreach around the community needs assessment that's done, and then kind of you work on this, I work on that kind of thing. But unless they are that formal merge, and I like how Bob put that, it's those kind of on the same grounds is a very good description. Not a lot of sharing like billing and administrative supports. But I wonder about billing. That's why I raise that example, because that is, as I mentioned in my comments, it's a very specific skill set that most of us don't have. Is that an opportunity area? Maybe instead of having 2 billers, have 1. Because if you can free up some of the support things that Lisa and her team do, administrative things, so they can then focus on services for staff, that might be an angle to try to look at. You'd be innovating a little bit.
Right.
Short answer.
Well, and you bring up a good point. With a small shop type of situation, it's pretty hard to be a champion on everything. And if you're providing total service, you're probably behind on your billing. If you get caught up on your billing, you're probably behind on your service. So it's just hard to do everything.
One of the ways that we looked at increasing our billing return is contracting with someone who is kind of a regional expert in health department billing. Um, Is one thing that we've kind of looked into.
Good.
To fill that need. As Jules getting started, she has all kinds of other training that she's needing to do, and that billing is such a specific and intense burden that she needs to focus on other things. And so if we can find someone else that can get the money to return back to us. Something that we're looking at.
Thanks. Questions, comments for Dr. Bob or Randy?
I know we've talked about it on a couple of different things here before, but where all these little counties are getting smaller, we're going to have to start combining resources with county and Plymouth County, and it's going to be kind of a challenge to get all that done, but it's definitely going to have to be. I mean, public health could probably Walls County, Greeley County. I mean, it would be a good mix to start with because we've already got healthcare up there. So, I mean, it's just a thought. We've talked about combining different resources with different counties. I don't know if it'll ever get done, but it's definitely something to look at.
It's a good point, and it's one of the things I think is challenging when we look at health policy, and rural health in particular is when they talk about, healthcare costs, they never really take a serious look at out-of-pocket costs. And so anytime that you kind of centralize some services and whatnot, you have to stop and think about, well, what are the out-of-pocket costs for the individual seeking those services? So not to argue against, but just, always thinking about unintended consequences as you debate centralization is you have individuals who, in most cases, a lot of it, if you break down the age groups who obtain services at the local health department, it's probably weighted a little bit more toward the 0 to age 20 age group. Not that they don't have, a pocket like pregnant and childbearing women age groups, but these are folks who typically are, if they have to pack up, let's say, and go for the WIC appointment 30 miles away, they've got to either pack up the kids, leave them at daycare, take time off work if they work, and so, but that's never figured into the actual cost to the individual, right? It's more the program costs that we tend to focus on. So I just say, don't forget about the individual, right? If we want to remain patient-centered, community-minded, I think that's something you have to weigh. Not that there aren't areas that have looked at, saying, well, we don't want to do the daycare inspections and licensing and whatnot work. Let's the county over here do that for us. Well, same thing with WIC. They've got a good WIC program. Let's let them run it, and they can take care of the region. The site doing that service oftentimes gets a little possessive and a little bit more focused on their local county. And so sometimes those services are a little slower coming to the county that's relying on that centralization. So I've heard that and seen that as well. So it's certainly something to look at, but I think you have to really consider all the unintended consequences.
If I may piggyback with my thoughts that stimulate those two I mentioned, SEK and NEK, they still have a presence in each county with this. So they're regionalized, as Sheriff mentioned. They're still in each community, so to that person, individual sense. But then also one of the things that crosses my mind, if I'm in a small community and I go out for a doctor's appointment or out to go get parts or whatever, I'm spending money in another community. I'm probably stopping at the grocery store in the larger town. I'm buying gas there. I might go out to lunch. So be thoughtful when you do those things, would be my advice, that you don't further send your economic activity to another county because people have to go somewhere else for their help. They probably will take a portion of their spending somewhere else.
Well, that's one of the challenges when you talk about regionalization is where are you going to put the office? You know, where are you going to have to go? And I know, you know, yeah, and I know our local hospital has always had the thought process of bringing the physicians to the patient rather than sending the patient to the physician. And that's, you know, so anytime you regionalize, yeah, there are several hurdles to jump, and that's one of them. But so many of the times, you know, your decisions have to come down to the dollars you have to work with, and sometimes that's you just never have enough dollars to do it like you'd like to do it.
I have a question for Lisa. How far back are you on your billing? I mean, what's our current position on billing?
Melissa has come in, since she has gone on, she's had a few times to get caught up on the billing. And she made the comment that, you know, it's easy to do the billing and focus on the billing, and that's the only thing that you're trying to do and focus on. We're probably 3 weeks, like I've had 3 weeks of appointments that.
So maybe 3 weeks back. One of our problems as commissioners, Lisa, is, you know, we sit here and we look up budgets, but budgets is expenditures against a budget. And so we don't always see the revenue side. So if we can see your billings against your expenditures or your grants against your expenditures, we're not so heavy-footed on just the fact that, well, yeah, over budget, you know, get this thing under control. And so when we say get it under control, then we start looking for options. How do we get this so that, you know, we're responsible to every taxpayer in our county? So one thing you might show us, and you showed a few weeks back, total grant dollars for this year, somewhere around 26 to 30,000, I think it was, you know, and show us how that comes back against your budget, because you make the expenditure, we pay the expenditure, the grant dollar goes back to the general fund, I believe, but it doesn't go back against your budget. So that will make your budget look much better, much clearer, and I think you have much more support when that happens. So
It's been really hard with the multi-year COVID grants.
Yeah.
We've gotten
yeah, because
hundreds of thousands.
because it's so big and now it's so small and it's so up and down. I understand that. But we only can make decisions based upon what we either learn or what we see. So if we can see that's great. The point on another person doing your billings, I understand, but that other person was at 25 something an hour. Not that that's going to be their $57,000 a year expenditure, because they won't spend the 40 hours, I understand. But if you or Jewel can do that billing and that, bring that back to your budget in-house, I mean, that's an efficient spend of our dollars. And that will help, I think, our understanding and responses within our public health.
Okay, I want to be respectful of Mr. Bowman's and Dr. Bob's time. Does anyone other have any questions, comments for the gentleman? Anything else we need to know? I think we're good.
Appreciate your time. It's
Yeah.
a long ways from home. We appreciate you coming as far as you can get and still staying within Kansas.
And it's all downhill when you go back.
Right. Better guess, Mike.
Okay, thank you. Thank you.
Thanks, guys.
Lisa, do you have anything further for us?
So, if it's okay to leave this set up.
Yes.
Yeah.
Yes. Okay. With that then I would move that we adjourn the the County Board of Health meeting.
Second.
It's been seconded by Alan. All in favor, say aye.
Aye.
All opposed, same sign. Motion carries. Well, let's take a 2-minute break and then we'll come back and go back into the session. order. They called for a special board meeting for a couple items. So it's been moved. It's been moved by Monty, seconded by Alan. All in favor, say aye. All opposed, same sign. Motion carries. We are in session. First thing for the agenda, we have a contract in front of us. Let's see, we probably need to go into executive session just to discuss that. So we go into executive for 5 minutes to discuss contract negotiations. Yes. Do I have a second?
I mean, to shut it off, but that's just
Okay.
just in case.
Right.
Okay, with that, I would make a motion that we approve the AWAS agreement with, let's see, it'd be Smith Land Company in the amount of $20,000 for the AWAS project at the airport. Funds will be reimbursed by the airport grant.
Second.
It's been moved and seconded. Any further discussion or comments? All in favor, say aye.
Aye.
All opposed, same sign. Motion carries. Um, We will have those checks written and the agreement here, and they can come in and we'll ask them to come in and sign the agreement and they can pick up their checks.
And I think they wanted to do that tomorrow? Was that tomorrow?
Yes,
Or did
yes.
Yeah.
Yeah,
So
they'll
would-
pick.
immediately.
Can we handle that, Madam Clerk?
Yes.
Okay. And I'm gonna pass that down back to the
And-
clerk.
And we're just doing the difference in the check that we've written and this one, or are we doing new?
That would be, what's best for,
We'll just do the difference.
Okay.
The check is already here from the last time.
Yeah.
We'll
Yes.
just add the difference of
The
$6,000.
of 7,
7, excuse
Yeah.
me, it was 13.
13,
Yes.
20 total. Okay. Thank you. And Scott, did you have something?
Yeah, I was gonna mention in the health meeting, but we now have a new county health officer.
Oh, good.
Dr. Grove has agreed to
Great.
take on that. I talked to him Friday and then I double checked Saturday to make sure he was, and he's on board to do it, so.
Good job. Okay. That's good. Okay. Also, I want just a couple things. In our discussion.
Can I ask about that? Okay.
Yes,
Are we paying Dr. Grove? We need to get that decided.
Dylan, what was it? Was like 60 some bucks a month or, I mean, it's nothing. And he's really not too worried about it. He didn't care either way,
So
so.
we can discuss, he can come in, we
Yeah.
can talk about that, or
Yep.
if he wants to pay,
That-
or if he's gonna do that voluntarily or whatever.
Yep. We can discuss that with him and see what he wants to do.
Yeah. It's a token.
Yeah,
It
he's,
ain't my-
yeah.
Yeah. Well, good.
He wasn't too worried about it,
Yeah.
obviously.
Doesn't it help to a lot until it does?
Right.
Suffered for one.
Yeah.
There you go.
What an asset Dr.
But for
Groves
now,
is.
he's agreed to take it.
Yes.
What an asset Dr. Groves has brought to our healthcare system.
Yes.
He's a
And-
good
and
dude
this
too.
is effective,
He was, I told him we had a meeting today. He didn't think he could make it, which he didn't, so,
okay.
which is pretty short notice, so. But he's in OR today, so that's why he didn't make
Is
it.
it probably effective today?
Yeah, that'd be fine.
Effective today? Thank you.
Everybody-
Sorry.
That's fine. Everybody good on that?
Mhm.
Okay. Another comment, in our discussions the other day about water. It was brought to my attention that the groundwater district and Scott City or the state of Kansas is issuing some funds for communities. The KTAP program that they had, or the
WTAP.
I guess, from what I hear from the legislature is that it's not as successful as they thought it was going to be. It's not working extra well, so they're thinking about sending some of that money rather than to WaterTap, to WTAP, to the communities, let them spend it on their own. But so with that, and I know a small community in Wallace County and at Weston. I can't remember the exact number that they said that they received, but it's like 300,000, 350 to implement a water system within their town through groundwater management. So I would suggest that and I know Alan has worked with her and we can either have Stan or Scott would probably be more familiar than Monty or I with the groundwater district to go set up a meeting with Katie sometime or groundwater district and see what's available for communities through groundwater district.
It doesn't hurt to ask.
Yeah, if you all would like to do that for us.
Yeah.
And
No problem.
okay, so that's that, and also I gave you some information on Sunrise staffing. You can look that over. We can discuss at our regular meeting next week.
Okay.
And if we want to take action, we can take action there. But just for your information to look it over. The one part of it for regular staffing isn't too bad, but the other part's pretty pricey. So, but we take a look at it and see if we even want to get involved with them or not. Um, Also, we'd like to set a time for this weekend on Saturday to conduct an interview with an applicant. Would there be a time on Saturday that would work better or good for everybody?
We do it in the morning.
Can.
Sure.
I'm supposed to be in Ordway sometime Saturday afternoon, so.
Okay.
I think the preference would be in the morning.
Perfect. Yeah.
Does that work for you, Scott?
Whichever.
Time make much difference, Alan?
Yeah.
9 o'clock?
It's fine with me.
9 o'clock, right here. Can we get in here at 9 o'clock?
You can, I may not be available,
Okay.
so as long as I'm, if there's going to be more than 3 of you, we'll need someone to take minutes here.
Okay,
They can always get in at the sheriff's office.
Yeah.
we can come in from down. Okay,
They'll buzz you in, you have to push the red button and they'll buzz you in.
okay. There will be a full board,
Okay.
to my knowledge, and Stan will be back by then. Unless he enjoys Manhattan enough, it may be a state, I don't know.
But you will probably go into executive session.
Yes, we will.
Anyway. Okay.
I can write up the minutes for that. No problem.
Yeah, we can take minutes.
Will you be here? Probably not.
No, they're doing
Okay.
I can write those minutes. That's no problem.
Can we read them?
Yeah.
Of course.
I will
used to do
visit
this
her.
all the time.
To see if she's.
We'll have to have it, for Al, we'll have to have a translator.
Right.
Yeah,
It would just be here to say, oh, they went into executive session as well, so I'll double check too.
and probably will be no action taken. Action can be taken at the next meeting. If there's action to be taken. If there's action to be taken, it can be done at Monday.
It'll be a special meeting as well too.
Yep.
You can turn that on and off.
I will not be here this weekend either, so I won't be able to help.
That's fine. We won't need it. Yeah.
Okay.
Okay. 9 o'clock, Saturday, 21st. Nope.
I have a check.
Saturday,
26th.
26th.
26.
Okay. Do you need a signature on that check?
No, I have a check though that has been given to Greeley County for 5,000, but if you want to talk about that on Monday, I won't be here, but I can give it to one of you, or we can just bring it out now.
Okay, yeah,
Is that okay?
yeah,
I'll just give it.
let's just discuss it now.
I've been needing to do that.
I'm not sure I understand all that.
Yeah, I haven't even looked at it yet. I was just.
I'll just let you do it, Steve.
Okay.
I don't know who went to the meeting last, but evidently they made an impression.
Where that meeting was.
From the Boot Hill Casino?
Yeah.
Well, I think we should take this back
I do
and
too.
invest it. Just invest it.
I think
Just-
so.
Let's go all in, triple it.
Where's that letter opener used to always be? Oh, this is open. It's open. Okay, we've received a check to the Greeley County Treasurer in the amount of $5,000. What was this for?
There's a little letter there with it too as well.
Boot Hill Casino and Resort is proud to celebrate 15 years of tourism, entertainment, and community investment in Southwest Kansas. As part of this milestone, we are excited to introduce the Trail Program, a new charitable giving initiative designed to enhance tourism, support economic growth, and celebrate the heritage of our great region. As a valued county within the 22 counties of Southwest Kansas, we are pleased to enclose $5,000 check as part of the Trail Program's direct funding initiative. This annual financial contribution is intended to support the county's efforts in recreating new tourism events or enhancing existing attractions. Whether it be festival, concert, rodeo, or another initiative that showcases the best of your community. At Boot Hill Casino and Resort, we believe the local leaders like yourself know best how to invest the future of the Southwest Kansas, invest in the future of Southwest Kansas. Through this funding, we hope to empower your community to grow its tourism offerings and create unforgettable experiences for visitors and residents alike. Thank you for your continued dedication in strengthening tourism in Southwest Kansas. We look forward to seeing the positive impact of this investment in your community.
Wonderful. So,
We gladly accept.
yeah, and, we could, one of our biggest tourism events is our fair.
Yeah.
So,
Our
fair,
Got that in
school
the-
reunion.
Okay.
We can definitely find a
Place
spot
for that.
it.
So where are we gonna deposit it into?
Well, we would make out a check from our general fund probably to wherever they decide.
Right, so it's deposited into the general
Reimbursement.
reimbursement. That's what I'm asking. Where am I gonna put this money?
Yeah.
I think that's
General
where
for now.
I will put it, and then we will discuss
Earmark it later.
maybe where we can.
That's what I was thinking, like all school reunions or
Yeah.
whatever.
Mhm.
Are they
Fair,
very
school
cool?
reunion,
They've done.
those are good spots.
Yep.
I mean,
But I hadn't done anything with it.
tourism
Well,
dollars
good.
would come from that event, I think.
That is very nice. of you.
That's fine.
Yeah, we appreciate the contribution, and some of that's probably ours that we've left there at times.
Might be, might be.
None of yours, not mine.
Yeah.
Not mine. I haven't had a meeting there, but
Uh,
can't say.
I just don't go there.
I had supper there.
It's not a bad steak. Okay,
Okay, we'll do that then. We'll.
anything else from anyone? Just one other thing, I would like to compliment our city workers, employees for their job on the water. The other night, it was hit by we may have to rediscuss our charge for the boring through the city. It was hit by the group that's boring for Idea Tech, and but our crew was, I mean, the water was down about 3 hours is all, and tell you what, they got in there, they got it done, they figured out the problem, and I was pretty impressed with the way they attacked it. I was a little disappointed that some of the homes around us didn't bring out brownies or cookies or anything while we was working on it, but why they were working on it, I was just watching, and but I was thoroughly impressed with the way our crew handled that situation. They pat on the back.
They did a great job, but they also showed us that there's probably a little investment we could do there. A little bigger, better saw maybe to cut through the concrete. We might want to open it up a little bigger hole, make it a little easier for them. Make sure we have those couplers for repair on hand, because we will not have time to go find them somewhere.
Right.
So just a couple little things that maybe we could make their life a little better with.
I think that's right. As I was standing there watching them fix that, my mindset went to what can we do to invest in to help make their job easier.
Right.
And one of the suction pump that
Right.
keeps the water out of the hole wasn't working extremely well. I mean, it was a little touchy. And so, that's one thing we may want to look at down the line, but, cutting the hole, make it big enough where two people can get down that hole rather than just one,
Right.
to make the job a little easier, things like that. So just those things keep in mind,
They did a beautiful job.
but, they done well. And I guess,
So how'd the pipe look? Was it all for?
I looked at that and I said, well, the good thing is the pipe's still in good shape, because
Good.
the walls of the pipe was in good shape, but underneath it, there was two little pinholes, but you probably couldn't put your small finger in it, but it's wearing, whether it was rubbing against a root or
Well, they
what.
do.
But just a small little pinhole.
Why it broke, but I'm glad it was a boring and not a.
Yeah, it wasn't a break.
That's
The
good.
people that were boring for the line actually hit the line.
Are they liable for that?
The
Boring?
you'll have to ask somebody
Right.
besides me.
Make some additional contribution.
Yeah, you double that 5,000. Okay, anything else? If not, we'll see you all here at 9 o'clock on Saturday morning. I'd entertain a motion to adjourn.
I'll make that motion.
It's been moved by Monty. Seconded by
Yeah.
Alan. All in favor, say aye.
Aye.
All opposed, say